Introduction and getting this session going. Good morning, everyone. I'm Rama Padman. I'm a professor of management science and healthcare informatics at the Heinz College of Information Systems and Public Policy at Carnegie Mellon University. Before we start, I'd like to give you some idea about, where I'm coming from. I mean, how this area of healthcare analytics and informatics is an area that I've got involved in. So my teaching and my research are now at this interface of healthcare, information technology, and analytics, analytic methodologies, paradigms more broadly. By that, I mean the use of operations research, management sciences, statistics, machine learning. How can we apply those methodologies to analyzing the huge amounts of data that's being generated at to solve problems that arise at the interface of healthcare and information technology? So today I'd like to give you some taste of really how this data gets generated, why we need to think about the large-scale analytics and informatics, and give you some examples of how all of these pieces come together in improving healthcare for everybody, for the individual, for the population, and for society. So let's start with a few definitions. And we will get into these in more detail as we go along. And I'd like to encourage you to ask questions, to bring up your own discussion points as we go along. So we will stop frequently to kind of have a little bit of an interaction before we move on to other topics. So analytics and informatics in the healthcare area. So healthcare analytics is really about data, to be able to, where does this data come from? How do we acquire it? How do we manage it? What kind of analytics do we apply to the data? And what does that analytics result in? How do we interpret it? And do we need to transform the data in order to be able to make good decisions? So how do we really collect, collate, analyze, synthesize, summarize data in order to generate knowledge that can translate to good decisions? And that decisions, has to be based on accurate, consistent, and timely information. So this is really a great definition of what healthcare analytics really is all about. However, before we can do the analytics, we need to have ways to collect the data. And that's one of the pieces of informatics, which is the use of technologies that are embedded in processes used by people to produce and use data. Now, of course, we do want to make sure that this data can be trusted, it's credible, it's accurate, it's timely, and so on. So we want technologies, which is what informatics is all about, the technologies, the process, and the people that enable us to deliver trusted data for good decision making. And without the technologies, we cannot collect large amounts of data. And data has always been collected in the care of patients in healthcare. But we need, in order to generate huge amounts of data where we can apply these analytic methodologies, we need technology. So let's take a look at some of these. Now, one of the big changes that we have seen in the past 2 decades is this digitization, tremendous, rapidly growing digitization of healthcare delivery. In the context of e-commerce, in the context of transportation, in hospitality, in manufacturing, we've become very used to using technologies in banking, financial transactions. We have been using technologies at scale. In healthcare, it's taken a little longer. It's a very complex domain. And so now we have this digitization that is really transforming the industry. And I want to show you some examples. Some of you may be aware and may have used some of these. And certainly, I think, with mobile health and so on, you have been using technologies related to healthcare management. But let's take a look at electronic health records, for example. These are technologies that collect data on patients. So it is in the care delivery setting, in the clinic, in the hospital. And as you can see, the electronic health, one of the reasons why this data is so complex is look at the types of data that we are collecting. We have pathology slides of images. We can see the text data of reports that are produced by radiologists. You have signal data of like ECGs and EKGs and so on, that are the tests that are done. There are digital X-rays, there are, MRI, CT scan, videos are done during colonoscopies and so on. So there are images, there are audio, there is structured data, there's text data, there are signal data. It is a large variety of data that comes together in order to create a holistic picture of the patient's health. So that's one type of technology that's generating all these different kinds of data. Then there is another, which, you can think of it as really created by internet-based technologies and services. These are social networking platforms. I mean, you go to Facebook and YouTube and a number of these platforms, but now there are online health communities. And the example that I have here is a community called a platform called Patients Like Me. It's a social networking platform that brings together patients with complex health conditions. And so you may be that patient may be the only one being treated by their physician. But when they come to this platform, now they see 500 thousands of patients from across the world who are, have this disease, are living with this disease, and now are able to interact with each other using the social networking platform. That generates a whole amount of data. Then we can see that there are mobile applications, whether it's for the individual or for the clinician. So let me just minimize this. These allow us to, for the individual, this is like tracking diabetes, blood sugar readings before a meal, after an activity, insulin that's being taken by the patient, reminders to do checks and so on. That's for the individual consumer with perhaps diabetes. And the clinical applications allow clinicians, doctors, nurses, radiologists, and so on to look up images, X-rays, and so on their mobile devices. And that technology has advanced to a point where you can actually look up and make, and interpret the data that you're seeing. We also have this movement toward what we call the quantified self. This is using technology devices, armbands and your smartwatch. I mean, I'd like to know how many of you are using a smartwatch or a Fitbit or these devices to be able to track, how many steps you're taking, the calorie intake, the number of floors that are climbed and so on. So this is self-tracking technology that we are using in order to get more information about how well you're managing your health. And then there are implanted prosthetic devices, whether it is the heart, the pacemaker, the heart VAD device, the wristband again, and so on. So these are all sensors, wearables, and devices that are also generating a ton of data. And finally, are these games for health? There are games that are available that perhaps you sign up on, apps that you have on your phone that allow you to, again, track your calories, the food intake, the sleep, the movements, and so on. And they are gamified. So it is fun and exciting to be able to use these applications. So you see that there are many different ways that internet-based technologies and services have really enabled healthcare data collection. And then the question is, okay, so what do we do with all of this data? How do we improve care management for a patient, a caregiver, the clinician, give the right information to the clinician, and really make good decisions for societal health. And so a report came out that talked about really how much data we're talking about here. I mean, I've not even mentioned the amount of genomic data that's being collected per individual. And so you can get these tests done, generating again huge amounts of data. So just in clinical information systems, which are these electronic health records, the prescribing technologies, and so on, about 5 to 10 gigabytes of information is being produced per individual in just these clinical settings. And then many much more through these individual applications, social networking platforms, and so on. So that's really the scale of the data challenge that we are dealing with at the current time. And so, what do we do with it? So this is a very specific illustration of data that's being collected in the pediatric ICU. And this is really to really look at investigating severe sepsis in babies. And that the staggering amount of data that's collected is 1 to 5 readings per hour, creating 43 million plus readings a day per patient because of all of this instrumentation that is being utilized in order to manage the patient and manage the sepsis that is developing. So I hope this gives you an idea about the challenge that we are facing with the availability of data. The question is, how can we make this data consumable? So I'd like to quote a very well-known Nobel laureate, Professor Herb Simon, who used to be here on the faculty at Carnegie Mellon. And he called it a consumability challenge. In 1971, that's really 50 years ago, he said, in an information-rich world, the wealth of information means a dearth of something else, a scarcity of whatever it is that information consumes. The question is, well, what does information consume? He said what information consumes is rather obvious. It consumes the attention of its recipients. So what does that mean? Says that then he said a wealth of information creates a poverty of attention and a need to allocate that attention efficiently among the overabundance of information sources that might consume it. So, and this was 50 years ago. And in these 50 years, in the healthcare setting, with all of these devices, sensors, technologies, clinical, social, mobile, visual, the amount of information that's just being, is available is overwhelming our ability to process, to understand, to synthesize, and then to be able to make good decisions based on what's being collected out there. So that's what health analytics is really trying to address. So let me transition at this point and ask the question, so why pursue healthcare analytics or informatics? And so the first point I want to make is that, let's see, I'm having a, okay. That because of all this data that's being collected, we have a data-rich environment, which I've mentioned, but it is analytics poor. So we need to bring all these analytics methods to the data to be able to make sense out of it. But more importantly, what does that analytics deliver? It provides, it improves our ability to make inferences so that we can make good decisions. And I'll illustrate this with a few examples. So at this point, I can stop for a few minutes to kind of, take any questions or any thoughts, ideas, and discussion points that you want to raise. But basically, the idea is that at this point, we have seen that all these different ways data is being collected. And so analyzing it and understanding the technologies that are being utilized to collect this data makes this work really exciting and challenging. It also gives us a chance to transform the healthcare sector, whether it is for the patient, like I said, the caregiver, the clinician, the technologist, the vendors, software developers, the government, the state and federal government, at all levels, we have an opportunity to improve the delivery and management of healthcare, reduce the costs, improve the safety, because we now have data to get more visibility into what is going on, and resulting in, I hope, what we can get out of this is a very mission-oriented career. So let me pause there a minute and see if there are any questions or comments from you.
Rema, this is Dave. I'm not seeing any questions coming through on the chat, but yes, just as a reminder, feel free to use the chat or unmute yourselves with any questions that you want to bring up with Rema and with the rest of the audience. Rema, just on my mind is, with the last 18 to 24 months that we've experienced in the United States in healthcare, do you see this becoming and do you see an evolution in the challenges that we face in the sharing of data between different entities, whether it's federal and state government or the government entities with healthcare organizations?
Oh, that's a great question, Dave. So two ways to think about it. One is that it took us about 15 years to from 2004, when the vision for electronic health record systems in every physician's office and hospital and health system was articulated, to actually get it on the desk of individuals. It took us about 10 to 15 years. Now, in the last 2 years, and so the technologies, the informatics, the standards, the guidelines that all needed to come together to make that happen took that much time, but even more so to bring people on board to be able to actually utilize them, so that we can now collect the data and then track progress of patients and so on. All that took time. In the last 2 years, it was almost like, in the 18 months since the pandemic hit, almost overnight, the health system and the patients and the federal and state governments, the payment systems, reimbursement models, and virtual care delivery formats, the health system has been really transformed. And so we now see, not just these sensors and devices, but telemedicine really has taken on in a huge way to deliver virtual care delivery. So you can see, you don't really necessarily have to go to the hospital or the clinic to see your clinician. You can have online visits, electronic visits to take care of routine care, and so we do see a transformation that this pandemic has resulted in, has caused with respect to all aspects of the healthcare delivery environment, from, as I said, from payment systems to safety checking to actual interactions between clinicians and patients, and all these social networking platforms, to tracking information, monitoring patients remotely, and so on. So this has really transformed, I think, much faster than it would have otherwise. So we want to think of a silver lining in improving the delivery of care through data and technologies. The pandemic has really speeded up that process.
Yeah, that brings to mind, necessity is the mother of invention and innovation here.
Exactly, and we see that exactly, and we see it very dramatically demonstrated in the healthcare environment, which is what really makes it even more exciting to work in this area at this point in time, when we are seeing a huge disruption and transformation for the better, I hope. And so we really need to study what's really happening, what is working and what is not. So let me then move forward and talk about and to just demonstrate some applications. So the question, okay, now we see all of this data being developed. We see the technologies that are producing, allowing us to collect all of this data. But what are the specific types of problems that we can solve? Of course, it's huge. So just to give you a taste, of a problem in the clinical setting, another in the public health. It could be the pandemic, and opioid epidemic has also been a huge concern in the public health sector over the past several years. An example of an operational problem that we can address using analytics and technologies, informatics, and then purely using technology, making use of technology artifacts that exist out there to be able to help individuals in managing their chronic disease. So let me take each one of these, and again, I encourage you to post your questions in the chat box, and we can have a discussion. So I'm going to start with the chronic clinical setting and in the chronic disease area. So, just the statistics associated with chronic conditions in the US. We have a population of maybe, let's say, 335 million. About 6 in 10 adults have at least one chronic condition. And by that, you mean either diabetes or high blood pressure, chronic lung disease, asthma, obesity, cancer. These are all chronic conditions. 60% of our population, adult population, has at least one chronic condition, and 40% have two or more. And that managing that chronic condition over the lifetime of the patient is really costing our health system maybe 80% and more of our 3.4 trillion healthcare costs is devoted to managing chronic diseases in the population. So this is a staggering challenge. And I want to give you an example of one way perhaps that clinicians and patients can really be helped using analytics and technology. So the illustration I have here is in the context of chronic kidney disease. So kidney disease affects the kidneys. So over time, they deteriorate, and finally, over 5 stages of kidney disease, from normal to end-stage kidney disease, kidneys fail, and then patients need dialysis or transplant. And you see the statistics here. 1 in 10 Americans have some level of kidney disease. And the precursor of this is, people with high blood pressure. We have a large population with high blood pressure or diabetes, and together, almost always, patients end up with the severe condition. And you see some of the numbers on the cost annually. It's about 10% of Medicare costs, even though it is 10%, 1 in 10. So about 30 million Americans having living with this condition. So the question that we want to ask is that, huge amounts of data is being collected, as I mentioned, in electronic health records. And as part of routine care, you go see your physician, or there's electronic health records in almost every clinic and hospital, health system, and so on. So when the patient has an encounter with the physician, that the information is captured in the electronic health record, can we make use of it? What can we learn with that data? And so one question that is really of interest is, how does this disease, because it's a chronic diseases, they progress over time, and there's no cure for them. So how does this disease progress over many years? Can we cluster patients following diseases in distinct ways? What are the differences amongst these clusters? And that's what we are seeing here. So what we see here is that, so we took data from electronic health record of a large kidney disease, so nephrology practice. And we tracked those individuals over time using kidney function, a measurement of kidney function as the indicator to track these patients, and over 10 years. And there are about 2,000 patients, let's say, in this set that we are analyzing. What we notice is that when we first start, they are all in what is known as a stage 3 of the disease. That's when nephrologists start tracking these patients. But then over time, you see them progress, the disease progresses using very distinct pathways. And the way to interpret these numbers is that we see that about 20% of this population falls into the low risk category. Their disease is very stable. Over 10 years, really, they are still remaining in stage 3, not much is happening. But you see this bottom trajectory these are labeled as very high risk. It's only 6.5% but 6.5% of 2,000 odd patients, their kidney function is declining rapidly. And so if the clinician looks at it, they would say, wow, these patients are trending toward a dialysis or a transplant. Should we get them on the transplant list earlier? How can we predict? So this is good. You can look at the population and say, my population of patients, the clinician says, population of patients is really following 4 distinct pathways. And you can label them low risk, medium risk, high risk, and very high risk. So maybe the very high risk and high risk are the patients that the clinician wants to track. And so the question that they want to ask is, can we predict which group a patient is likely to belong to, and how early can you predict? So this is actually useful indicator to the clinician, especially as the information gets tracked in the EHR, first visit, second visit, 10th visit. Well, does it really take 10 visits over these many years to find out, to be able to identify whether the patient is going to be high risk or low risk? It turns out that in about a year and a half, 18 months or so of tracking, the kidney function of patients, and using indicators, demographic and clinical. Does the patient have hypertension and diabetes? What is the BMI, the body mass index of the patient? Whether the patient is African American or white, male, female, age, and so on. Just few risk factors. We can actually identify within 18 months or so which group this patient is trending to based on their kidney function, which is based on a lab test. So this now can be implemented in a tool that is linked to the electronic health record, so that every time the patient comes in, this indicator will say the patient still is a stable, kidney function is stable, patient is in low risk group, or the patient's kidney function has really deteriorated. The patient is now being labeled as being very high risk. So this is now an alert for the clinical team to help manage the patient in terms of change of medications and all of that. So this is an example. Kidney disease is just one example. You could think about it in the context of diabetes, cancer, obesity, and so on. So this is one way where we're using technology, data, processing, and relevant questions that arise in the context of clinical care to create tools that can really improve outcomes for patients and management of patients from a clinical perspective. So let me, any questions at this time?
I think we're still clear. Thank you.
All right. So so the next is then, the public health. What are, and we see this, we've been living through it during this pandemic. And the opioid epidemic, as many of you may be aware, is a serious problem that we are dealing with. In 2016, for example, 42,000 Americans died due to overdose, and 40% of those deaths involved a prescription opioid. And if you look at the Medicare data, the prescription database, 76 million prescriptions were written in just 2017 alone. So there is wide distribution of opioids in the population, and is resulting in these bad outcomes. So I advised a capstone team, and this is one of those experiential projects that really help the students in the healthcare analytics and information technology management program to get hands-on experience in working with large amounts of data, framing these types of the important questions, and then figuring out a way to generate some answers. And so what the team did, and the students in the team came from multiple programs, very interdisciplinary, from our healthcare analytics program, from the public policy and management program, from the information systems program. And they brought the different sets of skills to be able to answer 3 major questions. Now, I'm not going to go through all of these. I know it is really a dense slide, and I apologize for that, but I just wanted to give you some highlights of, in the context of the opioid epidemic, what are some major challenges that we can look at using analytics and technology and publicly available data. So all of this data is available in the public domain. And one of the questions was really, can we identify, so this is the focus of that project was really looking at opioid epidemic in Appalachia. And what are some hotspots? Are there counties? And of course, over the years, we know that there are some counties that face a heavier burden of opioid epidemic compared to others. Can we find them? Can we find them early, as quickly as possible, using prescription data? And so applied statistical methods to be able to identify the counties and then look at the patterns over time. The second was that Medicare is really concerned. This is the Centers for Medicare Medicaid Services, which part of the Health and Human Services Agency, is really concerned about fraud and waste and abuse in the prescription of opioids. So 76 million is a very large number of prescriptions for to be written in any year. And so here the team used machine learning methods in order to analyze this large amounts of data to be able to identify what are, what type of waste are we seeing? Are we seeing them in specific counties? Is there a fraud with respect to claims in the that are submitted on prescription written for opioids and so on? And the last was really, well, as a result of these problems, CMS came up with some ways to address them and put out these regulations for public comment. But how is the public responding to it? The public could include healthcare organization providers, payers, software developers, agencies, state governments, and so on. And so if you want to get a sense for 10,000 comments, what is the sentiment associated with the 10,000 comments? Is the public indicating that this is actually a very good regulation or not? So the team used natural language processing methods in order to be able to analyze that data. So you see depending on the data that's available, there are multiple questions that we can frame and then apply lots of different methods to the data to be able to look at some, to generate the outcomes. And so in the first instance, in challenge one, identifying counties of concern, the team created a dashboard to easily identify and compare county level indicators of opioid misuse. In the second challenge, exposing fraud, waste, and abuse, the machine learning methods provided insights about what kind of investigation should CMS undertake in order to find the right where this fraud, abuse, and waste is happening. And in the third, it's really trying to get a sentiment of the public sentiment with respect to new regulations that are being proposed in order to address this issue. So you see here again, the use of technology, the analytics, the people, the process to be able to address a huge problem that we are facing in public health. The next one, the operational, an example of an operational solution using technology and analytics is in the emergency room optimization. So this was really a project with a local health system, but it is a widely prevalent issue in the sense that, when patients come to the emergency department, they come from other hospitals, they come from home, they come from accident locations and so on. And during that transfer of the patient to the emergency department, quite a bit of information is gathered. But when the patient arrives at the emergency department, that transfer of all that information in a very efficient and useful way, consumable way to the clinical team that's going to now treat the patient, there is a disconnect there. Most of the time, this information doesn't really get transferred. So we call it a loss of pre-hospital information, so that the clinical team has to start all over again from scratch to gather information about what happened, who's this patient, what are the big issues. The patient has chronic conditions. The patient on medications, so they have allergies. They have to start all over again. So the challenge that was posed was, is there a way we can extract key pieces of information, maybe age, gender, medications, and diagnoses that this patient may have from the stream of information that's provided by the paramedics who are bringing the patient, or by the doctors from the sending hospital, the hospital that's sending the patient to a different center. Uh, there is on call, information that's gathered during these calls, information that's delivered by the air ambulance team, information that's delivered by the ground ambulance team. It's either in a sheaf of papers or it is residing in a voice call. And it's hard to extract that information, just 4 or 5 pieces of key information. So the task here was, how do we efficiently extract this information into just a record that can go into the electronic medical record? The clinical team can look at it and say, oh, so this patient, 76-year-old male, has had a heart attack before, is on these medications. Now let's go move faster in order to decide what treatment to provide. So this helps to make the treatment process efficient, faster, and potentially produce better outcomes. So this is an operational problem because you want to optimize the care delivery at the point of emergency department arrival. So that's an example. And the last example I want to highlight today is on the use of social media technology. That we're all comfortable using YouTube, looking at YouTube videos, Facebook, Google searches, and so on. And I'm sure if I ask how many here actually have watch YouTube videos, I'm sure everyone's hand will go up. The question is that this is huge amount of information again, and there's information that's really very useful. So a staggering statistic again is that there are more than 100 million videos on YouTube platform on just health related topics alone. That is, and so 100 million plus videos on health. So if I want to find out how to, so this is really a how-to video, how to do an insulin injection. So here is a diabetic patient who's just newly diagnosed, wants to learn, how to do an insulin injection in order to maintain their blood glucose levels. You can go to YouTube and pull up, just say how to do an insulin injection, and up comes a large number of videos. How do you know which video is credible, which is accurate, which has the most updated information, is produced by a credible, authoritative source? We just don't know. We don't have a monitoring mechanism at the current time to be able to rate these videos and let consumers know, here are the videos that you can actually utilize to manage your care or to learn about the condition, and here are the ones that you should avoid. So this one you see here, it just a very short video, about say 6 minutes, 5 to 6 minutes. It's actually produced by a health system, University College London in as part of the National Health System in the UK. Similarly, here we might say the UPMC or Harvard Medical School, Mayo Clinic, and so on. So credible organizations producing this. So we want to be able to understand, really, is this a credible video or not? On the other hand, we also hear all this concern about fake information, disinformation, misinformation. So here are some examples. So again, a diabetic patient, very concerned, they've just been diagnosed with diabetes, puts in a search term into YouTube, is there a cure for diabetes? And what you see here are about 5 of the more than 160,000 results that show up. And if you look at these top 5, what we see here is that here is a video labeled as a cure for diabetes. It's actually a biased opinion against doctors. The second one is an advertisement. The third one is given by a medical expert. It's a fairly long one, 25 minutes, but one can assume it's a medical expert. Perhaps there is useful medical information in the video. Fourth one is just an advertisement. Fifth one, just you can be cured in 72 hours. Clearly, it is false. It's a chronic disease. So you see here the challenge that we are facing. On the one hand, huge amounts of really useful information. On the other hand, huge amounts of really fake and information that misinforms the public, that is, or the patient that's who's looking for reliable, credible, accurate information on learning about their disease. What can we do with it? So this is again where we can bring together technology. Can we design recommendation systems? So recommendation systems are similar to what Amazon and YouTube itself and others use in order to say that, well, if you have watched ABC, perhaps you might be interested in watching D video as well. So can we design recommendation systems? But at this time, what we want is to be able to retrieve videos on the topic of interest that actually contains medical information. It's understandable to the viewer. Maybe it provides actionable guidance, and it's using this user-generated visual social media content. And with what goal? Well, maybe for the individual, it is health literacy. For the public, it is public health literacy, education, and engagement. Because a lot of studies have shown that a health literate patient is an engaged patient. An engaged patient has better outcomes. So we know that this is has already been established, evidence in the literature. But how do we generate information using this very popular platform, medium, to generate, recommendations that for the conditions and the questions that we end up posing? Because we know that, we don't get all the answers in the health system. You go to the clinic, you talk about the problems that you're facing, you get a diagnosis, you get a prescription, but you may have many, many more questions about living with the disease. So you want to be able to go to other sources. And so this could give you this additional information. So that's where we use technology, analytics, machine learning, natural language processing, optimization, and so on, to be able to first search for the videos, then apply these methods to filter the videos down, maybe from 10,000 videos down to maybe 20 videos. Now, those 20 videos meet all these criteria: good information it has, it's understandable, it's actionable, it's credible, it's produced by organizations that are credible. Now we can give it perhaps the clinician, a diabetes educator, a dietitian, a physician can look at it, 20 videos, 5 minutes each, and say, well, yes, these are the top five that I'm happy to prescribe to my patients. So that's really how we are envisioning that, at the point in time when the patient is diagnosed, let's say with diabetes, along with the prescription for medication, here is a prescription for watching 2 videos that will introduce the topic of diabetes, done very well. It's easy, should be easy for the patient to understand, so that there is just in time. Next time the patient comes, perhaps the medication needs to be changed. Here are 2 videos as to why the medication, this new medication, will work better. And so just in time, personalized, contextualized education that makes the potentially can make the population more health literate and engaged, hopefully with better outcomes. So, creating the tools and technologies is one challenge. The other challenge is the translation of it, which again, working in healthcare informatics and analytics, that's one of the challenges that we need to face. That is not sufficient to create these platforms and tools and so on, but we also need to work with the people and the processes of care in order to really translate them to practice. So, and then to be able to analyze, evaluate them. Does it really work? Is it working for the patient or the caregiver or the clinician or the organization? How much does it cost? All of those issues. Is it safe? I mean, all of those issues or additional questions that are answered by this field. So that brings us then to, so that gives you, so I hope what you have seen so far is, really what the data that's generated, technologies creating this data, some examples of how this data gets consumed, and how technology and analytics can really help us make sense of all of this data so that good decisions can be made, whether by the clinician, the patient, the public health sector, in the operational setting, and so on. So how does that help us understand what are some career opportunities in order to be able to impact the field? Well, there's a provider field, the provider sector, the payer sector, then there is the public health agencies, such as helping to understand and manage the pandemic, the vaccine deployment and use, and so on, consulting organizations that are really helping with deploying these technologies, and of course, software developers that are identifying the need in the market, whether it's electronic health records, prescribing systems, use of mobile devices by consumers, and the devices and the data by health systems, and so on. Many different opportunities to really impact the field through these types of careers. So at Heinz, we have our healthcare analytics and technology students and healthcare policy and management students, really finding opportunities. Maybe about 39% go to analytics and consulting, 17% go to provider organizations, so healthcare delivery clinics and large hospital systems and so on, and certainly also in the insurance sector. So we see with consulting organizations, with technology vendors, with pharmaceutical industry. So all of these sectors of the healthcare delivery environment are all trying to generating huge amounts of data and trying to make sense out of it in order to answer questions that are specific to these types of domains. And the opportunities are the roles that folks can play are as an analytics consultant, as a data scientist, engineer, and change management, project management of these huge transformational projects that are undertaken by in the industry. So there are large partnerships that we see within consulting organizations, technology vendors, providers, and payers in order to really deliver, both generate, use the data, analyze it, but also do the translation piece so that the information is available at the point in time it is needed to make the right decision. So here is a quick summary of the skills. We have both hard skills, methods, technologies, data management, problem solving from end to end, from the time you frame the question with the end user stakeholder to actually delivering it to make those good decisions. So technology, analytics, methods, programming, and so on, that are the hard skills. But that this is not sufficient. It's people, process, technologies that need to come together in order to transform this industry. So we need to know how to really provide, explain the evidence that are provided by the data. So it means good storytelling, developing the strategies for deployment and improving uptake. Evaluation really is, use of these technologies. Evaluation is dependent on utilization. If the technologies are not utilized, we are not going to see good outcomes. So what strategies can we really develop? Could be both, as we look at it in the context of electronic health records, it's both carrots and both penalties and sticks and carrots, penalties and bonuses. And then how to work in teams, change management, project management, as well as negotiating, because there are so many players, stakeholders in the healthcare industry sector that we really need these types of soft skills in order to accomplish and solve these major problems that we are facing. And building these skills through coursework, through extracurricular activities, the experience that you might get in the industry in the summers and after graduation. So that's really one of the goals of our program in healthcare analytics and informatics. It brings together, students with varied backgrounds, but provide the training across this technology, analytic approaches, soft skills applied to problems that arise, exposure to problems that arise in the industry, whether it's from the pharma or the payer, the provider, the consulting, multiple perspectives. Learn how to solve problems in teams, so which is the healthcare policy and management, information systems, public policy and management, analytics and IT, students from all these problems coming together to share perspectives, develop strategies, and solve the kinds of problems that I discussed in those 4 examples. So let me stop there now. I think I hope you have a broad view now of what it means, what this healthcare analytics and healthcare informatics fields are about. And so let me stop there now, and I'm happy to take questions. Thank you for your interest and attention.
Rema, that's great. Thank you very much. I want to read off 2 of the comments from the chat here, both from Marissa. Thank you, Marissa, for that. It feels like there's been a rise of misinformation and lack of trust in our healthcare, especially with COVID research. How will misinformation and lack of trust in our healthcare influence the way we present data and findings in this field?
So this is certainly a very relevant and concerning issue. So the question is that, with all this data that's being generated, can we can we generate evidence from the data, which is the idea of synthesizing all of this data, and so it's both the message and the messenger. We need both of those to work in tandem in order to be able to build trust in the end user, that the information that's being delivered to them, in order to either maybe persuade them to get the vaccines, or persuade them to change behaviors. You need a combination of trust and of the message and the messenger. But the message, perhaps we can learn from the data, but the messenger also needs to be informed, needs to be credible, needs to really have the training and the background and the rapport with the stakeholder, with the end users that are receiving this information. So it is not, it's not a simple solution. We really need to, analytics and technology can help us analyze that data and generate the evidence, but that evidence need to be conveyed appropriately as well. And so that's the people and the processes of that transformation of data to relevant information that needs to be modified as well. So that's where I think people, process, and technology need to come together to be able to address this issue of trust and misinformation.
All right, thank you, Rema. So there's 2 other questions, somewhat related to careers and even preparation for graduate school potentially. And I put my email address in the chat for folks to utilize after this session, because I think these are broad questions that do vary based on specifics and students' backgrounds. For example, someone coming from a computer science or information science background, which is the general audience here that we have at INFOcon, how do they transition to a more specific career path in healthcare informatics? Is there specific steps that you would recommend that they take to do so? And right off the bat, for me, looking at resumes for prospective students who are looking to move from a technical background into applied technology in healthcare, it's pursuing internship opportunities and research opportunities, even fellowship opportunities during and immediately following their undergraduate experience, to help them to kind of dip their toe in the water to explore the field, make sure that this is the transition they make. But I can also say that if you're confident that healthcare is the field you want to go into, we do not require directly relevant experience in healthcare to be a strong candidate for the master's programs at our school in particular, both in policy and management and in analytics, because what we're doing during our program, that treatment of the student is it provides them with opportunities to complete multiple internships, capstone projects, client-based coursework that allows them to continue to build the equivalent of their resume to put them in a competitive position when it comes to applying for jobs upon graduation. Rem, is there anything else you would add to that?
No, I think you have covered it all, David. So the main, the only point perhaps is that I want to add is that really almost every course in the program has a project component associated with it. And for those of you interested in working in healthcare, and especially this analytics and informatics area, I would encourage that you work on projects, pick up projects that really have a healthcare component or a goal associated with it, so that with each project, you get to learn a little bit more about the healthcare context. And so because of the projects that you'll be doing in every course, you do get exposure to the payer side, the provider side, the consulting side, the pharma side, and so on. And then on top of that are the opportunities that David mentioned, whether it's in through internships, summer capstone experiences, and so on. So there are both longer term opportunities through like 3 months of summer, but really short term, 2 weeks, 3 weeks on every project that you'll be doing through the coursework.
And one other somewhat related experience or question regarding experience in undergraduate education. And again, I cannot stress enough, please don't hesitate to send me an email and I can pass that along as well to Rema and to our career services advisor who has depth and expertise in advising students on these very questions along the way during their master's program. So how does doing an undergraduate degree in health informatics compared to doing an undergraduate degree in something more broad such as biology? Have you heard from hiring companies that they prefer one or the other? And would it be better to do a master's degree in health informatics? And I guess my clarifying question for Lily would be, are you talking about a bachelor's degree in bio and then a master's degree in health informatics? Because that is a common path for our students in particular at CMU. And again, there's great amongst the I schools and everybody involved in INFOcon this week. There's a number of great programs out there for you to consider. For us in particular, we do see a lot of biology and chemistry majors, STEM majors who had broader undergraduate experiences, and they use the master's degree to really refine and focus their skill set. So having that undergraduate foundation in the sciences is fantastic. We also see some students, very few because there haven't been as many health informatics majors who've come through yet in the last 5 years, to then go on to get a healthcare analytics degree. But obviously the enhanced or additional education and that master's credential puts you in a competitive, gives you a competitive advantage in the job market when you're looking for that job after you finish school.
Yeah, no, I agree with that. So an undergraduate STEM degree, can help in the master's area with, the health informatics, analytics, computational biology, and those, a lot of different opportunities, AI and neuroscience, and so on. And I think, these days with genomic data really beginning to play a big part, the synthesis of genomics with health eye devices, sensors, and all these types of data coming together is also going to take off in a big way. So having an undergraduate degree in biology can really help with some of those interests as well. Lots of different pathways, many different opportunities. The main idea is that developing the skills to analyze the data. The data can be of so many different types and coming from so many different sources. But the techniques, the skills, the technologies, the methods to really analyze, synthesize, and then present this information in consumable ways is really going to be the big differentiator.
All right, I'm going to stop recording here and close things out, but thank you again to everybody for your time and being a part of our panel.